All right, well, good afternoon or good morning, depending on where you are. Welcome to our 2022 Newborn Screening Grace Award webinar, where we get to speak to and hear from this year's recipients. Next slide. Great. Just to let everyone know, this webinar is being recorded, and if you have any questions during the presentation, please enter them into the chat, and then we can start to collect those. And then when we are at the Q&A session, if you have other questions, you can use the raised hand feature. So that would be really helpful for us to keep track of all of the questions. So as I mentioned, today we are talking about talking with our 2022 Newborn Screening Grace Award winners. And GRACE stands for Generating Real Action by Cultivating Engagement. This is an award. We are in the second year of it. And it really started off with this idea to say, how can we really highlight work that is really being family and patient and public inclusive. So often we hear about, and we ourselves try to engage different communities, really think about how does that happen. And I think also we all can have that feeling of if something isn't absolutely 100% perfect, we don't necessarily want to share that with anyone. But really at the heart of this program and of this award is to really share both the wins and the lessons learned. And we are so excited to be able to have continued it from last year into this year. And we will be doing something a little bit special for next year. You all will just have to tune in till 2023. But really, it's been such a great honor to have the opportunity to spotlight programs and initiatives that are engaging families and communities in newborn screening. We all know that's the goal, and we all know that it isn't always as easy as it may sound on paper, but we really are happy to be able to have with us today a group that really exemplifies the idea of just starting in one place and then building upon that. Next slide. So without further ado, I'd really like to first say congratulations to our award recipients, the Illinois Sound Beginnings team, and really have them speak for themselves about what their projects have been, their approach, and to really be able to highlight all the amazing work that they've been doing. We know we aren't the only ones who've given some members of this team an award recently, so I think that just goes to show that all of their efforts are paying off and being highlighted in a lot of different ways. So without further ado, I pass it on to the Illinois Sound Beginnings team.
We'll go ahead and go to the next slide. This is Ginger Mullen, and we're going to talk about the beginning of where this started. So we'll go to the next slide. Illinois Sound Beginnings has been a collaboration since its inception. Originally, Sound Beginnings was the collaboration between the Illinois Department of Public Health, Division of Specialized Care for Children, and Department of Human Services, Bureau of Early Intervention. Now we are so happy that it includes the strong and robust partnership with Illinois Hands and Voices and Illinois Hands and Voices Guide by Your Side. The Illinois Department of Public Health works to support our 410 Illinois Statute 213, and which is the Early Hearing Detection and Intervention Act. IDPH holds the data information system and currently receives the CDC, Center for Disease Control and Prevention, EDDI grant. The EDDI program is fully grant funded and strives to meet the 136 goals that you see on the screen here of screening every infant no later than 1 month of age, getting them to diagnostics if they don't pass the screening no later than 3 months of age, initiating early intervention when there's a suspected or confirmed hearing loss no later than 6 months of age, and offering parent-to-parent support right from the start, but no later than 6 months of age as well. Through the years, we have strived to do this in a very timely manner. However, without our partnerships with parents, we weren't meeting our potential. We weren't meeting the timeliness goal, and we had a high loss to follow up. Thankfully, the program has been able to partner with Illinois Hands and Voices Guide by Your Side, which is a parent non-for-profit organization that reaches parents statewide, and there's affiliates in multiple other states across the country. The Guide by Your Side program provides unbiased information, one-on-one support and resources, and trained parent guides to talk with or meet with other parents. While Guide by Your Side works with children in the any age range, Illinois Hands and Voices does support children birth to college, providing resources and support. You saw in the initial slide that the Illinois Sound Beginnings leadership team includes the executive director, Andrea Marwa, Carrie Ballion, our Guide by Your Side coordinator, and Andrea Johnson, our Illinois Hands and Voices president. It also includes myself, Gabrielle Byers with the Department of Public Health, our social service program planner, and Kate Jordan, our vision and hearing consultant, also with public health. But there are so many more people that are included in this journey. We're supported by, in total, a staff of 6 at the Department of Public Health, a staff of 12 as part of Illinois Hands and Voices Guide by Your Side, and the Illinois Hands and Voices Board has 16 community members. Together, we do so much work to support our communities, and you can read more about those activities in our annual reports. Today, we're going to highlight one of our projects, which is the Direct Referral Project, which significantly impacted our journey towards equity for all families in Illinois. We'll go ahead and go to the next slide, please. So we're often asked, how do we fund Illinois Hands and Voices, or how do we fund this particular project? As I stated, the Illinois EDDI program is grant funded. We maximize those funds by leveraging resources and maximizing partnerships. Illinois Hands and Voices Guide by Your Side currently receives grant funding from Public Health to complete a detailed time-locked work plan with itemized deliverables. For activities that fall outside of the EDDI scope, Hands and Voices provides funding for activities. They're fantastic at fundraising to support all families, and they're able to provide sustainable and ongoing support to Guide by Your Side for opportunities that we cannot fund. Next slide. So a dear friend of mine once told me that some of the best plans have a 10-year germination. With that germination comes planning, contingency planning, nurturing, and waiting for the right time to bloom. Our path was very much that way. In the mid-2000s, the EDDI program was approached about the need for parent-to-parent support in our state. Shortly after that conversation, the EDDI program went through a year-long training on quality improvement. Because the seed had been planted early on, the EDDI program began to look for stakeholders with a shared mission who could equally benefit from a partnership. We had open and honest conversations, and that drove us to starting the Illinois Hands and Voices Guide by Your Side chapter in 2009. We worked towards our mission of parent-to-parent support. However, we had many stumblings along the way. We weren't meeting our maximum potential, and we weren't reaching all the families statewide. So we knew that there needed to be more parent support, more equity across the state, more inclusions of parents in focus groups, and mostly more parent voices at the planning and the decision table. So as the world was changing in 2019 and 2020, actually the stars aligned and our germination work had gone to finally bloom. So we were able to have a business agreement between the Illinois Department of Public Health and Illinois Guide by Your Side so that we could build on mutual respect and mutual programmatic benefits. And you're going to see this in later slides. Next slide, please. The Guide by Your Side model helps us to provide unbiased support and unbiased outreach to families, meeting the unique needs of families with a child who is deaf or hard of hearing. There are so many social, emotional, language, communication, and educational decisions that are posed to families, and they have to be those decisions have to be made quickly, even though a family may change their journey as they go. All of these needs foster early development, parent bonding, and kindergarten readiness. This perfectly aligns with IDPH's mission. The partnership allows the EDDie program to have unique reach at the community level so that the program can continue its quality improvement efforts that are inclusive, innovative, and scalable. Carrie's going to share with you our largest project, but keep in mind it's only part of the partnership that benefits both Hands and Voices and the Department of Public Health. Next slide.
Hello, my name is Carrie Valiant. I have 5 children, and my oldest is the one responsible for me doing what I am able to do, and that is parent-to-parent support. He was born deaf and started me on this journey. So I'm going to share a little bit about our timeline, and if you're a visual learner like me, then this graph is a great way to see our timeline of how things moved along in the order of our process. We officially signed our business agreement in March of 2020, and after that, things moved along pretty quickly. But we always kept in mind that we wanted to have our ducks in a row before officially rolling out, even if that meant pushing back our start date goal. Starting out, we were cautious of how many users had access to the data system. So we just started with a few users. This way, if somebody was out sick or on vacation, there was somebody to use it as backup. We also had our parent guide who is Spanish speaking trained so that she could input data directly from the family she served. As we were starting our direct referral process, we were also participating in the FEDDie project, or the Family EDDie project. Being on the forefront of the FEDDie definitions and data collection points was helpful because we knew what was going to be recommended to the CDC to consider for future parent-to-parent support reporting. So we built those data points into our database, which we call HighTrack, by creating a form that we could input the data points onto. We copied this process by creating special data collection forms for our different specialist roles as well. The next step, after knowing what data we needed to collect and having a way to store it, was having a way to collect it. So we needed a custom letter in HighTrack that we populated our baby information onto when we received those direct referrals. This custom letter is now our intake form. We have additional fields on it that are empty and are filled in and as the intake is done. After our family enrolls, the information is entered into HighTrack by the guide by your side individual who did the intake. Our start date goal was July of 2020. We wanted to start at the beginning of the quarter. We were very mindful of that. And by July 20th, we were ready and we started receiving those referrals. What helped the success of this process is that we continuously communicated between each other. Our programs worked together, deciding together the best days and ways to facilitate these referrals. I would reach out to those referred and then complete the intake form if the family chose to enroll in parent-to-parent support. This allowed our program to limit the number of people trained in HighTrack, and it was also how the process was handled before direct referrals. I'll share later more about these specialist roles as seen here at the end of our timeline. Next slide. We're going to dive a little deeper into what our team experienced serving families before direct referrals and the shift that happened after the direct referrals were in place. Next slide. The first shift is that the families that we were serving were having babies, right? We were used to serving families with children that were older. Sometimes they were less than a month old, and the family was potentially just told about the diagnosis the week before talking with me, which then made us the first point of contact after the audiologist. So they were gathering information, trying to understand the diagnosis and what those next steps were. I can't tell you how many times I've heard from a family, I don't even know what I need to know or what's going to happen next. And I connected with them by saying, I remember feeling the same way myself, but that's what we're here for. By talking to another parent who's just a little further ahead in the journey, they have a safe place to ask questions and understand those next steps. I also encourage them to keep asking. This is all new and it may take some time to get comfortable with it all. What I also found is that they were unsure of who does what and what their baby's hearing test results really meant. I ask if I can send information by email, by sending them some resources and about organizations that would be reaching out, so they better understand what those providers were calling for and who they were and how they'd help their family. By walking the family through what to expect, we were also able to share what is typically appropriate as recommended providers for a child who is deaf and hard of hearing, but also what to do if they don't hear from those that should be reaching out. They realize that their guide is more than just a person to chat with. It is someone who they can help understand what services are available to them and where to turn to when they experience mixed messages. In the past, when we were an opt-in program and not receiving referrals directly, we'd primarily get referrals of conflict families or severe losses or potential cochlear implant candidates. Not that those are a bad thing, but I think providers only refer to us the toughest cases rather than offering all family support. So after our direct referrals, we obviously saw a huge difference of hearing differences: unilateral, mild, microtia, atresia, conductive, and so forth. After experiencing this shift, we saw the areas where our Guide by Your Side team didn't have that direct experience and maybe needed to increase their training or provide them additional resources so they'd be better prepared. When our program was an opt-in model, we typically matched families within their regional area. Now we're finding that the regions really don't matter as much, and we tend to match more based on diagnosis, additional health concerns, and their ages of their children. Before direct referrals, we saw very few requests for support for families where parents were deaf themselves, or when they spoke languages other than English or Spanish. Since we receive referrals of all families whose child has been diagnosed as deaf or hard of hearing, we've had to work out how to serve families who spoke other languages. Also, we've been able to connect with more parents who are deaf themselves in the last year and a half, rather than the entire 13 years of our program. And I really think there's two reasons why this happened. One, since all families are referred, providers don't assume that because the parents are deaf themselves, they don't need that additional support. And then two, when I do see a family's primary language is ASL, I have our parent guide who is deaf reach out and explain what our program is, and then complete the intake form. We find that the family really feels comfortable communicating in their own language and supported in their choices. What we also found was that by helping families early on in their journey, it helped to prepare them to pay it forward. In fact, in our most recent call for applications, 83% of those that applied previously worked with a parent guide, compared to 64% of applicants in 2020. The beauty of that is they have experience on the other side of the table. They know what to expect, they understand the role, and it increases our retention of the guides as well. We've also had many families apply to be part of our ongoing quality improvement work groups. Next. Now we're getting to the fun part of the presentation. Gabrielle will now share some interesting data to show the impact that our direct referrals have had. Next slide.
Thank you, Carrie. So we have discussed so far our process and how we got started, and I'm going to share some data and visualizations that show our impact of our partnership and what we experienced. So briefly, we're going to be going over how our partnership has allowed all families to have an opportunity to resources. This partnership is helping us to reach national benchmarks in parent-to-parent support. It's improving enrollment rates in Hands and Voices, Guide by Your Side, and early intervention. And it's also helping us to pilot new roles and create resources that are specific to meet the needs of families. For comparison purposes, the next couple slides, data before direct referrals was captured between July 2019 and June 2020. And after direct referrals, the data was collected between July 2020 and June 2022. Next slide, please. Among many of the changes that we've seen since our agreement started was our ability to reach families across the whole state. Our reach wasn't limited to only serving those whose providers chose to share information about parent-to-parent support or refer the family themselves. As you can see from the map, which is colored per Guide by Your Side region, we've been able to reach every corner of the state after direct referrals. And that is because we're providing referrals directly from the EDDI program to Guide by Your Side. And just to show an example, if you look at before direct referrals in the blue region, there were 0 families reached. And after direct referrals, 21 families have been enrolled. So we're continuing to expand our geographic reach. Next slide, please. The agreement also improved racial equity as it allowed Guide by Your Side to reach out to every family. This in turn strengthened family empowerment as they had the option of pursuing parent-to-parent support. Comparing before and after direct referrals, the graph shows that after direct referrals, parent-to-parent support, we're able to provide services to a more racially diverse family group. The greatest changes that we've seen are in our Black and African American and Hispanic, Latino, and Spanish communities. Next slide, please. We suspected in years before our agreement that providers would pick and choose who they would offer parent-to-parent services to. And Carrie mentioned this as well. Before, referred families were typically those that had a complicated situation, communication barriers, or their child's hearing level was very severe, warranting more support. And we share this graph just to show that as our partnership continues to grow, we're able to reach infants with more varieties of hearing loss types. Next slide, please. Similar to type of hearing loss is degree of hearing loss. And I'm just going to quickly share what this shows. So about 5% of infants had a mild loss, and where the rest of this pie chart is about profound to moderate is equally split. So this is just serving that those that were enrolled in Guide by Your Side before direct referrals were in that profound and pretty severe hearing loss. After direct referrals, we hope to see a slight shift in this pie chart. And next slide, please. And you can see that after direct referrals, we do have more of an equal representation of variety of degrees of hearing loss. Next slide, please. So we've discussed location, our BIPOC communities, hearing loss type and degree, and we're going to move into some more enrollment and age slides. So funding from HRSA stipulates that we strive to enroll families in parent-to-parent support no later than 6 months of age. Because of our partnership, we've been able to connect with families much earlier than before. And this is shown in these charts as after direct referrals, the majority of infants enrolled. Families have infants that are in that birth to 6 months of age category. And if you look at before direct referrals, it's just completely flipped where the majority were in that 2 years and older. So we're working towards reaching families sooner and sooner because of our partnership. Next slide, please. And just to share how many families are getting enrolled in Guide by Your Side every year. So in 2020, there were 121 families. In 2021, there were 161. And in 2022, there were 83. And this just does represent about half of the year due to when our data collection stops. But we are on target to exceed 2021 enrollments. And we just share this because each year we are working on enrolling more and more families. Next slide, please. So early on in our agreement, as my other team members have mentioned, we're connecting with families younger and younger than ever before. So families are still learning about and navigating appropriate services. So we wanted to know, at the time of Guide by Your Side enrollment, do families know what early intervention is? This graph shows that yes, families were aware of early intervention. No means they did not know what early intervention services were provided. Pending means that they've received paperwork but have not gone on from there, and aged out means that the child is too old for services. And this chart just shows a dramatic difference in families in the no and pending categories before and after direct referrals. There's essentially no one in that no and pending before direct referrals, and after direct referrals, it's where the majority of families are. So because of this, our intakes have changed to explaining to families what early intervention is, the process to receive services, the role of providers, and helping families to connect to their local offices. Next slide, please. And as I mentioned, HRSA funding has us strive to enroll families in parent-to-parent support no later than 6 months of age. So how are we doing at that? Well, before direct referrals, about 12% of families are reaching that benchmark. And after direct referrals, about 67 to 68% of families are now reaching that benchmark. So that's a really great increase, really great to see. Next slide, please. And just some quick stats. So since we're able to reach families sooner and sooner, about 95% of our families who are enrolled in Hands and Voices Guide by Your Side between the years of 2020 and 2022, they also became enrolled or were pending enrollment in early intervention. An infant's average age at the time of parent-to-parent support enrollment is about 6.8 months of age. And because of our partnership, we've also been able to create 17 new parent resources, which I believe Carrie will now go into more detail about.
Next slide. Another activity that we've been able to do since our business agreement is to engage the parent voice early on through our focus groups. We assembled diverse groups of parents to gather feedback on resources, program materials, and websites, in addition to discussing the intake process and messaging used when serving families with children who are deaf and hard of hearing. Another product of our agreement were our snippets. This was an idea that came from our executive director, Andrea Marwa. She created a material called Leave It's, which was based around advocacy support. Serving families younger meant that they were just beginning to process and understand the diagnosis. After seeing this week after week, the idea of creating a simple one-page handout with brief bullet points on a topic and QR codes to take them to additional learning was born. When deciding what to call them, a snippet of information came to mind, and therefore our acronym, Simple and Informative Parent-to-Parent Education Tools. Next slide. We've shared how families were impacted by our switch to direct referrals, but how did this process impact our team? One of the biggest impacts was understanding equality, equity, and justice, and being able to have open and honest conversations on how to improve from where we were. This led to another new role within our Illinois Hands and Voices Guide by Your Side team. Next slide. This role is our Diversity and Equity Infusion Specialist. Earlier this year, Lydia and I discussed her desire to be a larger part of the program and wanting more of a leadership role. And the timing was perfect as we had just hired on some more Spanish-speaking guides that could serve the families that enrolled. We also needed to support the referrals where we received where English, Spanish, or ASL wasn't their primary language. Our Diversity and Equity Infusion Specialist provides ongoing technical assistance and resources at the national, state, and local level to the Hands and Voices Guide by Your Side team, EDDI personnel, and supporting partners for the improvement of community outcomes within disparate populations while protecting the privacy of families. Lydia has shared a quote of what it means to be in this role. She shared, being a first-generation Mexican-American means more than a language barrier. Culture, ethnicity, patience, and representation matters. Underserved communities need and deserve equal resources. Next slide. Shortly after starting our direct referrals, we asked, what's next? That is when I suggested the consideration of a transition specialist. And in October 2020, one was incorporated into our program through quality improvement processes and program partnerships. The specialist follows up with families transitioning out of Part C or early intervention and into Part B, our special education services. I had concern that since we were serving families so much younger in age that they wouldn't get referred later when times of transition happen, or they would have the perception that because they accepted parent services earlier, they wouldn't be able to access them again later. In addition, due to COVID, I was fearful that those families who would be transitioning out of EI would not be prepared for the transition. All of these reasons prompted me to ask our Illinois EDDI team if it would be possible for us to create a transition specialist role. Our transition specialist, Jacqueline, gets a list of names every month from the EDDI team of those that will be 2 years and 6 months. She then in turn reaches out to check in with them to see if they're aware of the upcoming transition and to send them a transition resource guide, which we created to help families understand this process. This guide has 12 topic areas with a brief overview of that topic and a QR code that takes them to a vetted link with more information. This guide was created specifically to support this role and is also available in Spanish. Then came another what next moment. Enter our lost to follow-up or LTF specialist. In February 2021, this role was introduced to our EDDI Parent Support Program through a COVID-19 pilot project. Due to the impact of COVID-19, our program was able to facilitate follow-up with families who did not make it back for follow-up testing after a failed hearing screen. They would reach out to the family, answer questions, provide tips to help them increase the likelihood of a complete test, and provide support in finding facilities to go to for that diagnostic test. They would document their communication and results within our database. This work helped families understand the importance of follow-up but also created a connection with those families, ensuring them that if the test did confirm a hearing loss, that they would have support afterwards. Since the initial rollout, we have tweaked the process and have dedicated one guide, Kelly, to a permanent role of the loss to follow-up specialist. I just want to pause for a moment and remind you that this all started just moments before the world shifted in response to the pandemic. We were adjusting to support families, hospitals, clinics, while also navigating the new work from home life ourselves. In turn, our parent guides were also supporting families with needs beyond just their child's hearing loss. The last consideration I want to mention is the difference between a business approach and the squishy side of a parent approach. I believe deep in my heart that the success we've had as a team is because as parents, we can relate and they can relate to us. Kelly's success in dropping the loss to follow-up rate is in her passion to serve and see things through, while also sharing from her heart that she also once thought that the repeat hearing test wasn't necessary. I'm not saying that our Illinois EDI team is not passionate, because that is far from the case, but parent to parent is just different. Next slide. So the Illinois EDI team does not take pleasure in sharing that over a decade ago, they had an 81% loss to follow-up rate per the CDC definitions. However, through their innovative processes, they've been able to reduce it. Thinking that 27% from 81% 10 years ago was a great accomplishment, we are excited to see that because of our partnering and the additional work that our loss to follow-up specialist does, we were able to drop it another 10% between 2020 and 2021 births. That's a 64% reduction during COVID. Aside from the amazing progress of the program and these stats, what this really all means is that there are less babies who may be identified later because they didn't follow up. And in closing this gap, it sets our families up for success. I've been able to share the benefits to families with you, and now I'm going to turn it over to Kate Jordan to share the benefits that the Illinois EDI team has experienced from our partnership. Next slide.
Hi, everyone. So during the COVID-19 pandemic, and even before this, we at Public Health were having difficulty meeting our 136 goals, our screening by 1 month, diagnostic by 3, intervention by 6 months, goals in a timely manner. And our partnership with Hands and Voices, Guide by Your Side, has enabled us to reach additional families in more efficient ways. We were able to take advantage of them, of Hands and Voices, Guide by Your Side, being able to use more modern communications, such as texting. They're able to text families, where at this point we cannot. Hands and Voices, Guide by Your Side are their parents calling parents. They're often living in the same community. And so we feel that families are often more trusting and more receptive to messaging and to phone calls from them. This raises the likelihood of parents to respond and to take action for their children. Hands and Voices, Guide by Your Side gives parents the knowledge and tools they need to make the choices that are right for their child. And because Hands and Voices, Guide by Your Side staff are active users in our information system, they can help us by providing real-time updates, such as, a new phone number, a new address, or, mom speaks Spanish, things like that. They can enter notes and comments about outcomes of communications. Parents are working alongside the EDI program for growth and sustainability. They have a real voice in systems developments, and their honest perspectives. They really uncovered previously unknown barriers within our process. Next slide.
Sorry, I know we've shared a lot already, but we would like to share what we have planned for the future. So I'm going to turn it back over to Ginger.
Hi, everyone. So
Next
in the
slide.
partnership, we'll show on this next slide that our germination of new projects is going to continue. You're going to be seeing substantial changes to our Illinois Sound Beginnings website, to the Hands and Voices and Guide by Your Side social media platforms. We hope to create short video montages or video educational materials similar to TikToks that help get our message out to all families statewide. We hope to be more culturally inclusive, and that we share the roles of the specialists with everyone and maximize their ability to impact families. We also have a project with Fostering Joy and trauma-informed care that'll be rolled out in the next fiscal year. We continue our continuous quality improvement to address the health disparities, improve our systemic development or our development of the statewide system. And we hope to have more focus groups around Spanish-speaking families and African-American families, because there's a special voice that needs to come in those safe spaces of discussion. We will continue to have data system improvements that will help our efficiency and our effectiveness. We have resources that will go out not only to parents, but to audiologists and physicians that talk about promoting EDI practices or the Joint Committee on Infant Hearing practices. We'll also talk more about snippets and how we can go past the first 17 and meet the needs that are out there. We also hope to incorporate the deaf and hard of hearing adult guide or adult role model by providing that support to families to see the healthy adults that their children will grow into. We also didn't stop there. We want to make sure there's sustainability for when we've moved on, that we have things embedded in the administrative rules, that we have effective communication that doesn't falter, that we have all of our stakeholders defined, that we have gotten the word out that there is mandatory reporting for all things such as screening, diagnostics, early intervention, and parent-to-parent support. And that's clearly stated in our law and our rules. We also want to make sure that at all costs, a patient or a parent's privacy and security is held to the highest standards. So that's a little bit about where we're going, and I'm sure the list could continue if each of my colleagues had an opportunity to add. But we're going to go ahead and go to the next slide. And we want to tell each and every one of you, thank you for attending today. Carrie has, if you didn't know, in March, Carrie was named the Outstanding Parent Leader by the National EDI system, and received at the Early Hearing Detection Intervention Conference for 2022 the Outstanding Parent Leadership Award. And we absolutely love her for her innovative ideas. And one of those innovative ideas are QR codes that she has brought to our life. So we'll pause on this slide briefly as we do move into questions in a moment. But if you click on any of those QR codes with your telephone, your smartphone camera, it'll take you straight to our websites. And you can also reach any of us at the email addresses listed to the left. So thank you so much. And I think we'll go to the next slide or pause on this as well.
Yeah, how about we leave it on this as people are checking out those QR codes and the different links to the resources. Thank you so much. That was a wealth of information and really shows just how in depth this project has gone and what you've been able to build out, especially your really impressive expansion of growth. A question that we have is, working, it isn't always easy to get people to engage when you are working in a state setting, right? Sometimes people have some concerns about that, and sometimes there are questions. Can you talk a little bit about, and that varies from state to state and the types of programs you're working in, but can you just kind of speak to that, what experiences you've had with that, and what has been your approach in terms of really trying to reach people where they are, even if they may be a bit hesitant around government?
This is Ginger. I think there's two different sides to this, so I'll ask Carrie to help me in this answer. I think sometimes people experience barriers or misunderstanding within their system, within their state system, and the only or the surefire way that has helped us is persistence and always being ready with options, opportunities, ideas, so that when somebody was in a meeting and said, could we do this? You have a laundry list of very well thought out ideas that you can present of how to reach the shared goal. And in this case, it is parent inclusion and parent involvement. I do think sometimes timing is a big part of it. And I think any state in the nation will tell you sometimes you do have to wait for different people um, to come into your life, to come into your program, to make the timing and the stars align just perfectly. So if it wasn't for Carrie joining me in this crazy journey and our whole Sound Beginnings team being able to come up with ideas, document it, write things up in the hopes that we would have an avenue to share that information with others, we wouldn't be ready on a dime. We wouldn't be able to maximize those opportunities to share with other people. This is definitely not a 9-to-5 job. Some of the ideas come at very different times. Some ideas get written on the plane on a ride home for a conference, or our bureau chief was fantastic about sitting on the train on our way back from Chicago and helping us with different ideas. So I think it's also about those interpersonal connections and the trust that gets built by continuously coming together and helping people understand. And it has to be a safe space for conversations to help people understand and to know what they don't know. Carrie, can you help with the comment though of how to reach families when it's the state that's sending the letter or doing the outreach?
Absolutely. So, you would think another parent reaching out would make things even easier, but sometimes there are still hiccups in different communities and diverse areas. They don't trust the system. They don't trust providers. They're worried about other organizations, whether that's immigration or child welfare. They might get confused with the acronyms that are out there. And that really was our one of our main purposes of creating that diversity and equity infusion specialist, so that we can explore getting into those neighborhoods and creating bonds with those leaders in those areas to create some trust and engagement and have them aware of who we are and our purpose and our goal and who we aren't connected to. So again, that was the purpose of that role. She started in May, but she's been transitioning out the families that she's been serving. So she's not going to be fully into that role until this October. And then she'll be running full force. But we have started exploring and then talking with others and how to really reach everyone and to have, some of those misconceptions addressed.
Great, thank you. And a question I was also going to ask is about your team and the team developing, because you have really quite a team of people, and you already touched on that in terms of the growth and learning. You talked about, one of the first things that was needed is mutual respect. And I think that is so great. I think sometimes people go to the tactical, like, oh, we need people to understand the protocols, or we need people to understand, right? So often we get in our minds, like, if you only understood, if you understood me, I just was wondering if you could talk, whoever from the team could talk a bit about, where you saw either those opportunities for mutual respect and just how that showed up, or just kind of the outcomes or the outputs of that, whether that was certain conversations or just anything that kind of points to that, the importance of that mutual respect right from the beginning when you're working with a range of different people.
Carrie's grinning just as I am. This is Ginger. I'll try to start, but I hope anybody will join in. I think you do have to, in these conversations, agree that you're going to agree to disagree at sometimes, that sometimes you have to have faith and trust in the other person, that I don't like this idea, but I trust you, you've proven yourself, and we're going to move forward with that idea. And it really comes from when we do have brainstorming sessions, every single idea gets put on the paper. We don't cherry pick, we don't delete something out. Every single idea comes in, and then we try to use a quality improvement process, which means bringing in one of our other public health folks, getting input all the way from our deputy director, our chair, our other Eddie staff, to the Hands and Voices board, or the Guide by Your Side guides, and looking at all the ideas and using a true model of everybody provide input to what was put on the table and what the ideas were. So, but we have had times where we agree to disagree, or we have to put something aside because we know that we are, one of us, the other of us, one program, another program has such emotion and passion around something. And passion is a good thing, but we know that we have to set it aside to give the other person time to think it through, or give ourselves time to maybe explain things or share our reasoning behind why we're so passionate a little differently. Carrie, do you want to tag on that?
Yeah, so I am truly blessed to be in the position that I am. I have got great support from our parent organization, from our executive director and the board. They let me run with stuff, but then they don't hesitate to contribute and share and expand and help me grow as a leader, which helps our program grow. In addition to, we've always started our meetings and our interactions, especially those that are new to the fold, with that mindset of, even if you can't say it exactly, perfect, just put it out there. And even if you think they're going to think this is silly, just put it out there. Because that you never know where that one idea is going to go and what it might spark. And I think because of that, and like Ginger said, just laying it all out on the table, it really has helped our program grow. We meet regularly, quarterly, with all the specialists, just to make sure that we're all on the same page of what they're doing, to address any concerns, to listen to them for what they're hearing, and how that might impact our programs, or what things we might need to tweak. So I think just that open and consistent communication is key. And then as the leaders, being open-minded, and just realizing that what you thought maybe once was perfect might not work later on down the road, and you might need to adjust, and that's okay.
This is Ginger again. I think I'll bring it back to something Ms. Bonham said at the very beginning, or at least paraphrase it. Carrie and I have also, with this team, been working at "don't let good be the enemy of great," which is a phrase we steal from our partners at the National Technical Resource Center of, sometimes you have to get something out there to meet the needs, and COVID definitely taught us that. It may not be perfect, but let's get it out there and work on it as we go. So don't let good be the enemy of great. And I think at Public Health, just as Carrie has that backing from her board and her executive director, we have that backing. The Eddie program is very fortunate. Our current leadership is fantastic about supporting us and supporting our ideas and helping us think of things in a new perspective, in trying to find us new resources, which has just really helped. The stars aligned, and we're very fortunate to have the backing of the department.
Great, thank you for that. And I think that last point is really important. It's so important to have backing of leadership and backing of the different decision makers in your system, especially when you're starting something new and you don't know what's going to come out of it, and you don't know what the numbers will say, as they say. Can you speak to a bit more about I loved that slide and got a couple messages around, what equity means to you, and why that's so important in this, and just how you see that evolving over time, perhaps, in terms of the work that you're doing.
Gabby, would you feel comfortable addressing that?
I can address some of it, sure. I had a feeling you were going to have me do that, but yeah. So part of my background is in informatics and health disparity research. So our first step in this equity journey is understanding what inequity is, equity, equality, and justice. So we wanted to make sure we had a basic understanding of that. And since we had a very, very amazing database in place and we started to collect parent-to-parent support data as well, we were able to perform quantitative analyses to identify our barriers or to identify what communities weren't making it through our program efficiently. So we had to first start with quantifying it, and we're hoping to grow towards a more qualitative assessment as well. So since we've identified it, this is why we're reaching out to Carrie and her organization to work on focus groups. Those that aren't getting through our system appropriately or efficiently, which was mentioned in a slide for the African American Black communities and the Hispanic, Latino, Spanish communities as well. So we are working on building trust and trying to understand what's going on with them, what's their situation. So it's really about just broadening our perspective and understanding of what's going on in these communities and how can we translate what we're finding into actionable events and experiences so that we can improve the livelihoods across the state. So that's where we're at.
This is Ginger. Just to add, Gabriella has really helped us. She looked at deprivation indexing. She looked at analyzing our data for the kids lost to screening, to diagnosis, to intervention. It wasn't just a single look at the overall population. It was broken down to see where in the chain, where in the system of care were some of the breakdowns occurring. So we're very fortunate that she joined our team and has that expertise to help guide us. And we also want to acknowledge Marianne Chenais, who was a University of Illinois student that joined us for a semester to work on that. And she's footnoted in our document that talks about disparities, but she's an absolutely fabulous addition and partner to this process.
Great, thank you for that. And I think that's such an important piece that you're looking at it from a range of different angles, and that now kind of going to that point of asking families what their experiences are. I think sometimes we can get caught up in the data, and the data gives you a part of the story, and that's really critical. And it's to say, oh, and so what we saw this trend, what does that mean to you? Because I think that, in the work that we've done, we've been able to learn a lot through that and to say, oh, I didn't realize I was making that assumption. And now in this conversation, we're actually seeing what the true barrier or the true issue is. This has been, oh, did a question come in? Sorry, I'm reading as I'm talking. So much of the success of your work is based on the implementation of specific steps along the way. Yes. What additional advice do you have, or what lessons have you learned to support successful implementation?
This is Ginger. I think maybe if we go through all four of us, I can go, then Carrie, then Gabby, then Kate. My comment would be that we have a phrase we joke about having the band back together, but it's the fact of working very, very closely together and not missing band practice, not missing time together, because we sound the best when we're practicing very frequently together, to use that analogy. We do have in our history, we have data, we have experiences to show that when we weren't as cohesive, when we didn't communicate and practice together as often, we were not serving families as well. So I think for me, it's having everybody together on a routine basis, whether it's 9 to 5 or not, to field the issues that arise and to keep the eye on the ball. So Carrie?
Yeah, I would say for me, it in the small steps really was embedded when we participated through the national quality improvement work groups through the NICHQ group. And really having drilled in that those small tests of change. You don't have to go and roll out something everywhere at the same time. Try it out somewhere, see if it works, make small changes, and then try again. And that's exactly what we did with our loss to follow-up specialist, is that we started in one part of the state. We started with a small area of birthing hospitals. We saw what we needed to change there. And then when we felt like she had a great process down and she was comfortable, then we expanded to another area, and we would slowly add in a different area of the state, building her up to the whole thing. And of course, leading her to the largest populated area of the state too, right? So you don't want to put someone's fire out before they even got started. So I think for me, that really truly is what I feel our success has been.
Okay, I guess I'll go next, if that's okay. I feel like, my background's a little bit different than everyone else here. So, Carrie's been in parent-to-parent support for a very long time, and Ginger's been an audiologist for quite a while, and so is Kate. So my background's a little different since it's in informatics, data science, and health disparity research. So I think something that I have found that's been amazing since they kind of took me under their wing is what can happen when you have a variety of disciplines come together to really help and improve processes in the state and ideas and innovative thinking. So, yeah.
Thanks. And this is Kate again. My perspective is very day to day, because I'm making, I'm getting the reports in on these babies, and maybe they've been diagnosed on a Friday and I'm handing them over to Carrie on a Monday. This might be a 3-week-old, baby, or it might be a child that's still in progress, but there's a strong family history or the risk factors involved. And so I know that, even though I'm not sure or it's very new, I can hand it to Carrie or one of her trusted guides, and it's landing in a safe place, an appropriate place. And she's going to say, oh, your family's not, she might talk to them and they're not ready, and that's fine. And, she sends them information. And also, she's able to update, and then I can make other referrals more smoothly with updated information and more information. And the other flip side of that day to day is working closely with our loss to follow-up specialist. It's daily communication. Hey, that phone number was no good. Can you find another one? Yep, here's another number. Here's a number I found for the mom, and just going back and forth, trying to reach families. So it's just been really a special relationship.
Great. Well, thank you so much for sharing all of that. Again, I think you all could teach a master class on partnership and, the science around implementation and, taking those steps and how that can really lead to big and positive changes. And so I'd like to take this time to close out this session and once again say congratulations on winning the Grace Award. And I think anyone who listens to this can see why you were the winners in terms of really that focus on family integration and all the different ways that can present itself and being able to build upon a program. So thank you so much for sharing that information today and for submitting your application. And thank you to everyone who's on the line for joining us today, and have a great rest of your Tuesday. Thank you.